head of the runs the Bioquantum Academy of Canada, and Dr. Zarrin has runs complete courses in homeopathy from you don't know anything to advanced practitioners and all sorts of integrative medicine therapies, and she has faculty all over the world. In fact, in 2 weeks, on it was in the email this week with a link. If you're interested, there's a webinar on a 4-hour webinar on the principles of homeopathy. I'm going to do a little piece on the history of homeopathy, but Dr. Zarrin's going to do the heavy lifting there, and she can explain that and when it is and all. So I'm going to let you introduce yourself. You do a better job of it than I can, and take it away. And thank you for being with
Dr.
me.
Bill, I don't know if Kayla has a question here. If her hand is raised, it just says she pressed that button by
Okay.
accident.
Kayla, do you have a question? Or was just that an accident?
Okay, there you go.
Okay.
Thank you, Dr. Clearfield, for your kind invitation and introduction, as always. And yes, I'm the founder of Bioquantum Academy, and actually, Dr. Clearfield is our inner faculty as well. And I always admire Dr. Clearfield for standing for right and truth, and never give up. So we are kind of people that we never give up. And he's being a great colleague and also as a faculty at the Bioquantum Academy. Thank you so much again for your kind invitation. I would like to have a quick overview on my perspective for some of attendees who might not know me, and just quick overview if Dr. Clifford allows me to go.
Go ahead.
Okay, let me just change the thing. So, okay, hold on a second. Just trying to minimize things. So, I'm coming from a different background. It's might, resonates with some of you, might not resonate, but I mean, I'm a classical homeopath, and that's my domain, that I believe in treating the person, not the disease. Because disease is one internal disharmony with countless manifestations, which we call them symptoms of the disease. And treating the individual person in order to remove the internal disease, it's something that I believe in and I have been practicing it. Reductionism approach and reactive medicine, which is the allopathic model, always fails in chronic conditions because suppressing or managing the disease never removes the internal disease. Healing is the art of human body. We are born with it, and the healing ability is endowed in all living beings, including plants, animals, and humans by nature, without exception. We all have the healing power. It's endowed with us. We are programmed for it. And there is no difference between healing abilities between human beings. But we should never underestimate the healing power of human body at any phase of disease, at any age. So sorry for this. Just move this quickly. The concept of healing and cure. Personally, I never call myself a healer because we are not a healer. We are physicians. We are assistant nature. We do not heal or cure from outside whatsoever. We're just giving people the right tools and reminding mechanism to heal themselves. The body heals and cures itself from within with the help of the right system of medicine. Healing always follows the natural laws and principles, and concept of cure is based on these healing laws and principles. The reason that homeopathic works, because homeopathic core principles are based on these natural laws. Violating these natural laws, violating the principles of healing, it's definitely is killing the ability, the power of healing. Your body can artistically and intelligently heal you with no effort when you activate your healing power to remove the disease, which is internal disharmony. Human body has one disease, only one internal disharmony with countless manifestations. But in allopathic model, every single and manifestation is called one disease and has a terminology. That's why in homeopathy, we do not care about those terminology. So we can heal the body on a timely manner, restoring homeostasis with the help of right mechanism, tools, and administration of naturally derived substances that is called medicine. So in generally speaking, that's the principles of healing and cure. As I always say, healing principles and concept of cure always follows the internal rules, not external rules. Internal rules are endowed within us by nature, and natural law is absolute. The law of nature is absolute, and nature never follows man-made rules. Human being is an absolute part of nature and follows the same laws and principles as programmed. Man-made rules such as synthetic drugs or artificial inoculations are the violation of these natural laws. Healing is an internal domain and never follows external rules. So this is a very short overview of my perspective. And now we're getting to homeopathy, which is the medicine of past, present, and future. Homeopathy existed from the beginning of life. So homeopathy is not just happened or it's developed in a full system of medicine by Dr. Hahnemann 200 years ago. But the concept of homeopathy, like cures like, has been around from the beginning, from ancient times, goes to Hippocrates, Paracelsus. So I would go back to the history of like cures like or similar concept from 1,000 years ago at the webinar that is coming in September 27. Homeopathy is a complete system of medicine that is the best choice for the countless chronic diseases, for many acute conditions, emergency cases, malignancy, infectious diseases, epidemic, pandemic, autoimmunity, and innate immunization. So I always talk about this that because I'm a follower of Dr. Hahnemann, and this is we all believe in that no medicine can do miracle without proper food and nutrition, without proper personal hygiene, public sanitation, pure drinking water, pure air, healthy lifestyle, and right environment. In absence of these essential requirements, healing processes are blocked, get exhausted, and restoration of health is either delayed or in some cases, it never takes place. That's why sometimes they say, oh, homeopathy doesn't work. So there are many, many reasons that they can cause the disharmony. All of them should be removed because no medicine can do miracle. No medicine can heal you when there is an existing chronic cellular deficiency, chronic cellular intoxication, harsh and abusive environmental factors. Dr. Hahnemann clearly stated in his Organon of Medical Art repeatedly. So I would like to get into my approach, and so I might have a quick overview on the two last cases that I shared with you. Homeopathy is the foundation of my practice, and integrative medicine is the enhancement of my treatments for a faster recovery. So I never treat anybody without the constitutional medicine, without homeopathic constitutional medicine. And also, on the other hand, I never do it without my integral approach. And integrative medicine that I choose are falling into the homeopathic domain. The reason to be compatible with the foundation of my practice. Integrative medicine is a natural domain, is an umbrella which covers many natural modalities such as homeopathy, nutrition, gemmotherapy, biotherapeutic medicine, homotoxicology, nutritional medicine, and many more. These medicines have been used for centuries in different parts of the world to treat human illnesses. So in homeopathic domain, we don't call it medication, we call it remedy. So remedy is natural, drug is artificial, medicine heals, medication suppresses. That's a difference between homeopathic model and allopathic model. So the human body is endowed with a natural superpower and ability to heal itself at any given moment. This healing power needs to be stimulated, activated, nourished, and supported in order to take action. All naturally derived substances that can do this job is called medicine. The medicine can be a nutrient, medicine can be homeopathy, medicine can be sometimes emotions such as love, and these are all called medicine that activating the healing powers in human body. Homeopathic medicine should be the first choice for activation of the healing power. So my cured cases, I chose very difficult cases to share with you by my homeopathic approach. The reason I chose these cases are, first of all, they were advanced pathology and they were rejected from other medical practitioners. They tried so many different treatments, allopathically, even natural medicine. And the last one is because I have permission to share it publicly. Proving about how we can activate the inner healing ability and removing chronic internal disharmony by homeopathic medicine to bring forth the cure, restating health gently, efficiently, and permanently. During the, walking you through my cases, these are going to be proven. My patients had tried many different allopathic medication and treatments for a long time without improvement prior to coming to see me. But how did they fully recover? I will explain to you, and I will walk you through my approach. The approach that I created, because homeopaths around the world, the science of homeopathy is never changing. But the art of homeopathy, it goes from homeopath to homeopath. When I went to, in 2009, I went to Germany for homeopathic exchange of knowledge. There were almost 400 homeopaths gathered for almost 10 days there. When I listened to every single homeopath from United States, from Canada, from Europe, from South America, from Russia, from Middle East, they were all did awesome jobs. So they all cured the patients, but not too often they had the same art. So they were all classical approach, but I mean the art was different. So that's why homeopaths around the world, they're not practicing it differently. They're just their approach is different. In classical approach for totality of symptoms of physical, mental, emotional. So the classical approach, as you might know, we gather all the symptoms from physical body, mental, and emotional body. We call it totality of symptoms in order to find the characteristic of the patient to match it with the most similar medicine in homeopathy. Because we treat the person, not the disease. Practically, we say we treat the sick, not the sickness. Homeopath does not find the disease. We don't do diagnosis. Homeopath understands the person to find a matching, similar remedy to remove the internal disease. It could be classical, or it could be in homotoxicology, or in form of modern homeopathy, still anything you choose has to be similar with manifestation of disease and totality of symptoms. So I created my own piece of art based on the science of homeopathy, which has made me to successfully treat thousands of patients around the world. The result has been astonishing to the point that has given me such a great tool and confidence to teach my personal approach to medical practitioners. A year and almost 2 years ago, when Dr. Clearfield knows about that we launched our platform, our educational platform, international educational platform in integrative medicine or homeopathy. I was often asked, what is your goal? What is your goal? What is your aim? I said, my aim is to not just bring changes, to transform the system, because the system is broken. And one of them on one of the podcasts say, is it possible? I don't think so, it's possible. I said, according to the quantum physics, every single moment there is 3,000 possibilities in every single moment. And that's how the universe works. So as long as you stand up for right, and the truth is going to happen. And and I said, why you're focusing on medical doctors? I said, because the medical doctors are the victim of the situation. They all want to help. They are on their own. And my aim is to convert as many as allopaths in my lifetime. It might be short, it might be okay, but as many as I can. And that was my answer. And now we are having 14 medical doctors graduating in December from Bioquantum Academy. So let me just get to my cases. And I chose these cases because they were advanced pathology, as I mentioned earlier. And the first one was a large thyroid tumor and nodules, female 62 years old, which I talked about it the last time. The second one for infertility 40 years, a female 40 years, and pregnancy in 4.5 months. A major stroke with the left side paralysis, seizure with vomiting, incontinence, and stuttering. And also advanced Crohn's disease in male 75 years old. So I would like to talk about my approach that, as I said, I will never go without my classical approach. I always go with the constitutional medicine, which is the foundation of my practice. But I follow with homotoxicology, gemmotherapy, tissue salts, oligotherapy, nutritional plan, educating healthy lifestyle, and also right environment. So by integration of the above modality, I enhance the efficacy of my treatments. Integration of compatible modality is the key to a speedy recovery. So generally, almost maybe 90% of cases, I create 6 protocols for each patient. Sometimes I have to create more protocols, but so far, as I said, more than about 90%, 6 protocols would be enough. The very first one is the semi-minimum remedy, which is repairing, patching the vital force and activating healing power. It's for alignment, for balancing. Normally 7 to 10 days. Second protocol, I go with the endocrine pathways homeopathic medicine, which we call it homotoxicology or biotherapeutic medicine. The third protocol, I add gemmotherapy for deep emunctory drainage, also adding oligotherapy for mineralization. I add organotherapy or sarcodes for stimulation of and activation of the organs. And also in case to case, I add nosodes for immune system fortifying or works on immunity, especially with autoimmune diseases. And the 6 protocols, either I repeat or I create a maintenance for them. So last time I talked about the thyroid. I'm going to pass this case. And the thyroid tumor thyroid tumor patient was scheduled to remove her thyroid. And she refused to do that. Not only she refused to remove her thyroid, she refused to go on any chemotherapy or medications. So she came to me after 9 months. Then the tumor was numbed. After 14 months, she was completely out of cancer. So because last time I talked about this, I'm just going to pass it. But if there is time left, I can go back to it. Okay, sorry, Dr. Clearfield, I have to just pass this. And the second one was the female infertility, that she couldn't get pregnant in 2 marriages. So in 4.5 months, she got pregnant with my treatments. Okay, so let me just go to the stroke patients, which is scheduled for tonight. Okay. So major stroke, then aftermath of stroke. Major stroke due to torn carotid artery. The complaints I received from my patients was left side paralysis, stuttering, grand mal seizures frequently, violent vomiting, and incontinence during sleep. He was 66 years old, athlete, very active, was a professional soccer player. He was the captain of his soccer team, very active, energetic, outgoing person prior to his stroke. His stroke happened in February 2009. He was hospitalized for 3 months in Canada and the United States. He tried a variety of treatments by several different allopathic medications, long-term physiotherapy, speech therapy, intensive home care by nurses, surgeries after a stroke. They did surgery after a stroke, and he was suggested to do more surgeries, but patients and his family refused to do so. He went for several different treatments after his stroke. He went, as I mentioned earlier, he was hospitalized for 3 months in Canada and United States without any results, was on a variety of treatments with several allopathic medications, long-term physiotherapy, speech therapy, and also intensive home care by nurses from hospitals. He could not even take shower himself. They did a major surgery right after a stroke, but again, they wanted to do more surgeries. History of medication and treatments that they wrote it in like a paper for me, that several seizure medications. He was on several seizure medications when he came to me. Seizure stopped for a short period of time, but then medication stopped working after a while. Seizure came back aggressively and more intense than before, and frequent relapses. Seizure medications were no longer helping him, and they were looking for alternative therapies. He did acupuncture, chiropractic, naturopathic medicine, herbal medicine, functional medicine, and several other natural treatments for more than 2 years. Nothing worked. He was hospitalized again for frequent grand mal seizures with violent vomiting and incontinence during sleep. Seizures was occurring during sleep more often than during day. Left side paralysis was getting worse than before, even though he was still on many different medications. March 3rd, 2012, they came to me 3 years after his stroke, after long-term consumption of medications and many different treatments. Came to me 3 years after his initial stroke with persisting conditions. Actually, the way they explained it, it was way worse than before. He was referred to me by his naturopathic doctor, who was one of my colleagues back then. He was walking to my office. I observed him the way that he was walking to my office, extremely slow, leaning on his right leg with a cane and help of his wife, which she was holding him, otherwise he would fall down. He kept dragging and pulling his left leg with much difficulty. Could not talk properly. I did not understand his words clearly because he had constant stuttering. He was complaining that he was very exhausted, no energy. He was very pale when I saw him and very drowsy. He was not eating properly as he explained. He had no appetite. He was not getting enough sleep because frequent seizure at night, and also loss of male function, low vitality, and severely depressed. So in case of neurological disorders or cases such as aftermath of a stroke, the picture of the patient is lost because of surgeries, because of so much suppression by allopathic medications. The homeopathic picture of patient is lost. In such cases, aftermath of a stroke, Alzheimer's, dementia, Parkinson, ALS, progressive MS, in almost all neurological disorder, I hardly can find a similarium of homeopathic medicine to match the picture of the person. But I am treating the person and not the disease. I have to always find a way to get closest homeopathic medicine to the person. Homeopaths cannot find similarium homeopathic medicine or constitutional remedy to match the picture of the person to medicine. It's the hardest thing a homeopath can do, but we have to. We have to do it the way that, from family, from close people, from friends, just get as many information as possible in order to understand the person prior to the stroke, because picture is lost. So constitutional picture is lost due to an advanced pathology and long-term suppression of symptoms by various drugs and treatments. So I was getting help from his immediate family that they were coming with him to understand his constitution or characteristics. So completed his case. I completed his case by getting help from his wife and sometimes from his son. His generality after stroke was declining. He was in hypo state and low biological functioning. Everything was slowed down. He was practically in survival state. The generalities was such as digestion and sleep and energy was terrible. He was severe constipated, was suffering from indigestion, low or no energy, lack of sleep, lack of activity, very anxious, alternating with depression. He was angry. The way I saw him when I asked him, questions, I saw anger in his face, very unhappy, impatient, severely exhausted, and argumentative and unsocial. I saw him like a couple of times that was arguing with his wife in my office. These are the exact words by the patient and his wife. Cognition was weakening, memory declining, concentration and focusing were reducing. Drowsiness throughout the day, sleepiness because of sleepiness at night due to seizure, vomiting, and incontinence. They said that he has no patient when for example, the TV is on in the house, and he had no desire to talk to people around him. His family desperately looking for help. So the very first approach, the very first step, it's a first aid injury remedy we call for emergency stem cells. No matter is a broken bone, or is a scar, or is a scrape, burn, concussion, or a stroke. Any form of injury has the same message to the body. A stroke is a severe injury to the brain cells. Brain has a local repair system, the stem cells, but not enough after major stroke. And it needs to call for more stem cells to be released from the bone marrow to rush to the brain for repair, healing, and regeneration. We do this with arnica. The first emergency or injury remedy in materia medica, in homeopathic world, is arnica. Arnica, I gave arnica 30 CH immediately, 2 times a day for 5 days, then once a day for 5 days, total 10 days. In physical injury, using low potency 30 CH or lower potency arnica, but more repetition. Never use high potency in physical injury. Arnica is the first injury remedy in homeopathy, no matter it's a skin, it's bone, it's connective tissue, or it's brain. Arnica calls for stem cells. Stem cells is our repair system. The second step is constitutional remedy, which was the hardest part of my practice with this case, because I had to get help from the family. And also the totality of presenting symptoms are helping so much to come to the right constitutional remedy. In a stroke, cases never start with high potency in the beginning. His constitutional remedy, according to the presenting symptoms and also the characteristics that I got help from his family, was causticum. Causticum it's a polycrest homeopathic medicine. It's a great neurological homeopathic medicine. It's a potassium family or Kali family. I gave him causticum 30 CH 3 times a day for the first day, 2 times a day for 4 days, and once a day for 5 days. Total 10 days, causticum 30 CH. Remedy, I selected remedy based on his current general, physical, mental, and emotional symptoms. 7 days break after causticum 30 CH, that's how I do it. After the constitutional medicine, I always give 7 days break. The reason is to let the body takes it over and then retake the case and see how the constitutional medicine works. So I did not give any single remedies after. Causticum, it's called Hahnemannian Tinctura Acris Sine Kali. It's from Kali family, from potassium family. It's an amazing neurological medicine. But interestingly, my stroke patient presented all the symptoms of causticum. Causticum is a polycrest homeopathic medicine, is very powerful, affects on all organs, main areas of concentration on nervous system and connective tissues. It has progressive debility, stiffness, and paralysis. In causticum, people are serious people, very intense, sensitive, sympathetic, idealistic, activist, intolerance, and great anger of injustice. Sometimes they're very angry because of injustice. They are political, they are rebellious, violent political extremists, and sometimes they experience deep grief from injustice. So because materia medica, amazingly, you can match the, the patients with, polycrest medicine on materia medica. The more I read the causticum, the more I was convinced that is the right medicine for my patients, because he was presenting almost everything. So causticum characteristic, it's, as I said, matched with the stroke patients, and it's because it's polycrest, affects almost all organs, all systems, including nervous system and connective tissues. It's amazing homeopathic medicine for cerebral accidents, from concussion to stroke, for neurodegenerative disorders, for seizures, epilepsy, convulsions, actually the convulsions with the modality that getting worse in sleep. Paralysis in advanced pathology, numbness of the left side, slowly progressive debility and stiffness. My stroke patient presented the picture of causticum completely. So I didn't need to do any differential diagnosis between the medicines. So at this point, because I was in the right direction and the causticum was the right medicine, then I continued with the pathways remedies, which are coming from homotoxicology. These are the endocrine pathways homeopathic medicine for a stroke. So when any advanced pathology or difficult cases, I always check the patient with the phases of disease, because I have to understand the phase of disease in order to create right protocols in homotoxicology for them. Because the disease evolution table for me, it's like giving me a clue which state, which phase the patient is. My stroke patient was in the degeneration phase of disease, which is the advanced phase. So accordingly, I created protocol for him. So the very first endocrine pathways protocol was the brain pathway medicine for brain cells injury, for convulsions, seizure, grand mal, and central nervous system. So, and also this, sorry, it's just, I cannot see this. Okay. Pathways remedy, I chose injury medicine, which is the important phase of the treatments. I started homotoxicology after causticum 30CH. I worked on injured brain cells, as I said, calling for more stem cells. Homotoxicology for injury, including a combination of most important injury remedies, such as arnica, belladonna, calendula, hemamelis, rostox, ruta, symphytum officinalis. So in the very beginning, I gave arnica alone. Then I gave the constitutional medicine causticum. Then I moved to homotoxicology pathways remedy. The first one, it was for the brain injury that has a combination of arnica, belladonna, calendula, or the homeopathic medicine that we call them emergency homeopathic medicine. Because no matter it was 3 years after a stroke, he didn't heal. It was not cured. It says my approach was a still emergency. So that's why I gave him emergency medicine. I gave this combination 3 times a day, 10 drops each time for 6 weeks. They were all in D4, D6 decimal dilution. Homotoxicology normally is in low dilution. So, but as I said, my approach was emergency for this case, and I gave it 3 times a day, 10 drops each time. The second homotoxicology or endocrine pathway was for convulsion, epilepsy, and seizure. This combination was including belladonna, bufarana, cupra metallicum, pulsatilla, silica, and zincum metallicum. Again, I gave him 3 times a day, 10 drops each time for 6 weeks. This combination was a little bit, the potency, the dilution was higher from D12 to D200. There is an important note. Before repairing injured brain cell, overall healing never takes place. So if I didn't repair the injured brain cells, I could never remove the entire disharmony in these patients. That's why my focus on repairing the injured brain cell first. So this another pathways was central nervous system pathways from homotoxicology, including phosphorus, lachesis, Ignatia amara, agaricus, magnesium phosphoricum, and zincum. These are coming ready, or you can ask your manufacturer or supplier to make it for you. This is an amazing combination for nervous system, central nervous system pathway. Again, I give it 3 times a day, 10 drops each time for 6 weeks. So after that, I started giving homeopathic tissue salts. Tissue salts are amazing system of medicine that they are prepared according to homeopathic principles, but in a nano size. And I chose the brain tonic. I chose the tissue salts that they're like a nourishment for the brain cells. These tissue salts, all of them, almost 5 of them, they have phosphorus. The first one is Caliphos, Calcium phosphoricum, Calcarea phosphoricum, Magnesium phosphoricum, Natron phosphoricum, and Ferrum phosphoricum. 5 tissue salts that contains phosphorus, and also Natron muriaticum in addition to that. This complex, this combination of tissue salts is an amazing brain tonic for almost everybody, but for stroke people or any brain injury, we should give it a little bit more often. I started, actually, I didn't write it here, but I started 6 times a day for the first couple of days, but I asked them to reduce it to 3 times a day, 4 tablets under the tongue for 6 consecutive weeks. I added, as that's my protocol. I always add, different system of medicine as we go. I added gemmotherapy for emunctories drainage, for opening up the emunctories, opening up the liver pathways, hepatic pathways, renal pathways, lymphatic system. Gemmotherapy are amazing system of medicine. They're coming from embryonic plants, from buds, shoots, and they have embryonic enzymes that they are very, very powerful. These enzymes called auxin or gibberellins, which the adult plants do not have these enzymes. Medicinal plants that come from adult plants or herbal medicine do not have these enzymes. That's why I always choose gemmotherapy for this purpose. I chose Alnus glutinosol, which is amazing for cerebral infarct after post-stroke. Tilia tomentosa for epilepsy, Ficus carica for anxious neurosis, and Ilex acufolium for epileptic conditions. I gave them 2 times a day, each of them, because my approach was a little bit aggressive because to me it was a still emergency. So 2 times a day from each gemmotherapy, morning and evening for 6 weeks. So gemmotherapy is not a mother tincture, as I said, is embryonic plants. It comes from buds, shoots, and very young part of the plants when they still have the enzymes auxin and gibberellins. You can give it individually or combined. So I asked them, you can mix them together, or you can give them individually if you have time. So his wife actually said, no, I would like to give it individually. I said, just go for it. So after all these treatments, all the protocols were designed, all the medicine were given, and all instructions they were given, and they went home, and they came for the first follow-up. It was May 5th, 2012. 2 months after the initial consultation with me. Some improvement in all levels of physical, mental, and emotional. As these are all the words that they gave me, all the words that they explained. He said he's feeling more relaxed, less depressed, and less anxious. I asked him the percentage. He couldn't give me any percentage, but he said, generally, I feel more relaxed. And he said his eating is much improved and he has a better appetite, which for almost 3 years, the appetite was not so great. He said he's sleeping longer and better cognition and better focusing and concentration. Seizures were still occurring, but shorter in duration and less intense, less frequent, less frothing in his mouth, less vomiting, and sometimes no urination during seizure at night, which his wife explained to me. And he said he's less tired when waking up in the morning. He was very exhausted in the morning because of his sleeplessness before, but he said he's better, he's less tired. So these are all the words that are reported by the patients and his wife. Okay, I retook the case because that's how I do it. After the first follow-up, I retake the case, and based on the improvements and based off every, again, presenting symptoms. This time he personally could have slowly answered my questions without getting help from his wife. I understood him better talking about his personality and characteristic prior to his stroke. When he explained to me that his personality, that who he was, exactly, again, calcium was confirmed. At this point, I increased potency of calcium from 30 CH to 200 CH. I gave him 2 times a day for 3 days, once a day for 4 days, and total for 7 days. I chose higher potency, but less repetition, less frequency. Calcium was working in stroke patients. That's why I did not change the medicine. There are cases that, when I retake the case, I have to change the constitutional medicine. But in this case, I didn't have to because calcium was working properly. Second follow-up, July 3rd, 2012, great improvement 4 months after initial consultation. Everything improved greatly and noticeably. Walking better, but cautiously. Talking better and clear. When he came to me, his left arm was just sitting in his lap. And I asked him to move his arm, left arm. He said he cannot, but he only could lift it with help of the right hand, the right arm. And to a certain very, very, like maybe maximum like 10 centimeters from his lap. So it's just a bed. He couldn't lift his arm. So lifting this in the beginning, initially, he could not move his arm before my treatment due to severe left side paralysis. But this time, he started lifting his arm halfway up. I don't know if you can see me, but initially he couldn't lift his arm at all, but just move it with the help of right arm. But this time he could move it up to here. He could not move his left arm, was always relaxed on his lap. As I said initially, in the beginning, I asked him to lift his arm. He couldn't straighten it up. But after this time, the follow-up, the second follow-up, he could lift it a little bit higher. Family reported about his positive behavior, more social, positive attitude. He started laughing, playing with grandchildren, more focused, hopeful about his recovery. So in the very first time when he came to my office, he was very angry at me when I asked him questions. Even when his wife is answering to me, he was looking at his wife very angrily, but this time was smiling, laughing, and joking with his wife. And so that's how I saw him on the second follow-up. He said the seizure were like a quick tingling, not even noticeable. Very shorter in duration and less frequent. His wife reported these incidents were not similar to his typical seizure at all, and she claimed that he no longer had seizures. But the patient were telling me, no, he feels tingling of seizure, that it is coming, but it doesn't happen. So I asked them to continue the same initial protocol. I did not change the protocol because of significant improvement. I repeated calcium 200 CH once a day for 7 days again. So the third follow-up, the last seizure attack before July. Wife did not even notice the regular seizure. He did not wake up during seizure attack. He was remembering everything in the morning. Before, he said he didn't remember anything. Even he had severe seizure, severe vomiting, severe urination, but he did not remember anything. This time, he said he's remembering everything in the morning. So huge improvement after these protocols. His cognition, memory, sleep, digestion, urination, appetite improved significantly. He was refreshed in the morning. He said there is no exhaustion, no severe anxiety or depression. He asked me that he wants to go back to work. Can I give him a letter to go back to work? He was already on sick leave for 3 years because he couldn't go to work. But that's why he was so positive, and he said he wants to be active. He started doing work around the house, getting along with his family, and feeling more content. So the rules of homeopathic medicine is when we see 85% improvement in patients, we have to reduce homeopathic medicine. Otherwise, the patient goes through provings, and we do not want to this happen. So that's why I reduced when I realized that he's almost 85% better. I reduced the dosage of all homeopathic medicine and related protocols to just 2 times a day from 3 times a day. I reduced the repetition from 3 times to 2 times because I didn't want him to experience any form of proving after improvement. So the fourth follow-up, December 24th, no seizure since July. Since the third follow-up, July, they said that he had tingling sensations, and December, he said no tingling and no seizure since July. Astonishing recovering in 5 months, walking comfortably without a cane, talking clearly, and no episodes of seizure. All generalities reported normal, except constipation. That was his default, I guess, because that was continuous, but less severe. Constipation was his chronic issue prior to his stroke. Before he had a stroke, he was suffering from constipation, but that got worse after stroke. I reduced all the homeopathic medicine to every other day for 1 more month, then reduced them to 3 times a week for another month. Gradually, I started tapering him off all homeopathic medicine due to a great improvement at all levels. So I designed him a maintenance protocol. January 28, 2013, memory cognition was highly improved. I started reading and writing. seizure-free for months. He was walking normally, lifting his left arm much higher than before, and no longer left side paralysis. He was walking normally, swimming regularly, back to play soccer for fun, not for competition. He was driving short distance, talking normally, and going on vacation with his family, back to normal life as he reported. My assessment was, at the last follow-up, he was seizure-free 100%. But with my assessment, left leg recovery was more than 95%. Left arm recovery and mobility more than 90%. Sensation in left arm and leg was fully back 100%. He could lift arms higher and hold it straight up to 95%. Could hold things without difficulty 100%, and he started driving. Full recovery. I designed a maintenance protocol for a few more months. I asked him to stop everything after the maintenance period when it's finished. Full recovery was achieved with astonishing and permanent result to this day. After a maintenance period, they sent me a beautiful testimonial of full recovery as my treatment exceeded their expectation. Breakthrough for my stroke patient. And they gave me a recovery testimonial, which is posted on our official website. You can go to clinic page, testimonial subpage, and read the letter. So I have the letter here. They mention my name, dear Dr. Zarrin. It was with pleasure that I provide you with our testimonial of Joe and his condition and how he progressed with your expertise. So they explained about that, the journey of treatments they have with the hospitals here and there, and they gave me this testimonial, and I discharged them to this day. So this was the stroke patients recovery, full recovery. But again, if there was 5% of, for example, he couldn't lift his left arm completely straight. I saw maybe 5% he couldn't make it straight completely, but he could lift it straight up to here. So, Dr. Clearfield.
Yes.
I finished this.
Yes,
I finished with patients. If there is any questions, or you want me to?
I don't see any questions in the chat. If anybody has any questions anywhere. Oh, here's one. What Materia Medica book do you use?
Materia Medica book. I have concordant Materia Medica. It's 7 Materia Medica in one.
Mm-hmm.
But I have a pocket one, Borica.
Okay.
Borica is always with me. Yes,
okay.
but the 7 Materia Medica in one, it's my main reference.
Right, and then I have this one, the Desktop Companion. That was your recommendation, and this is great for us medical doctors that are not classic homeopaths. It sort of gives it into it classifies things in our language, not the other way.
Yeah, the Desktop Companion is amazing to have, and also Desktop Guide is for I don't know, I highly recommend that to medical doctors who are bridging or converting to homeopathy.
Yeah, I've been using the Desktop Companion a lot.
Because Materia Medica, for example, Concordant and Borica is more for classical homeopaths, and but these two, Dr. Rogers Morrison, these are amazing books as well. I recommend it to medical doctors. So I think I recommended Dr. Clearfield before, right?
I think Kayla is raising her hand. She can ask her question now. Kelly, are you available? Or
Raise
Yeah,
her.
maybe. Oh,
it takes
there she is.
me a
Yep.
while to unmute. Sorry. Um, thank you for the presentation. It was great. And, I think homeopathy is quite fascinating. I have seen that it works well. Um, I had a patient bring up something and I wanted to see how you would respond to it. So I had a patient ask me, isn't homeopathy like placebo? How would you explain the use of homeopathy to a patient and how it works?
The patient asks you if homeopathy is placebo.
Yeah, so I wanted to know like your response to that and how would you explain the workings of homeopathy?
Homeopathy is not a placebo. Homeopathy is an energized, intelligent, and genius system of medicine. But the problem is with the system and the mainstream research that they're not supporting the science behind homeopathy that can be clear to people. The reason they say placebo because they cannot find any particles in a homeopathic solution. But the imprint and information of the original substances is left in this medicine in a form of waves or quantum objects. So that's why when they cannot detect the particles as allopathic medications, they call it placebo. But the healing is, properties and curing properties in a homeopathic medicine are in a form of waves or quantum objects. So if you'd like to know more about how you can answer these questions scientifically, please go to our website, bioquantum.ca, and go to publications and read my research on the science of homeopathic quantum physics, which explains it so well. And if you have a little bit of some background, you can understand it fully, and you can explain it to people that the science of biology or chemistry or even classical physics cannot prove homeopathy because there is no particle, there is no substance in a form of physical in the homeopathic medicine.
Okay.
So
Can I weigh in just for a second? From the medical doctor's standpoint, one of the ways I explain it, I know it's not perfect. It's almost like a vaccine where you take what is toxic and dilute it down to almost nothing or practice or even nothing. And then, when you apply it to the patient, then what you get is an antibody response. That's kind of how I explain it. I don't know, the medical doctor people, does that sound more plausible or at least more palatable? I know that's not the exact definition of it, but
yes.
There's no medical doctor that will tell you that a vaccine is placebo. Well, maybe the latest ones, but not the real ones from the polio ones and all of that. But that's kind of how I at least that's an explanation that's sort of understandable. So
Well,
yes.
to back that up, there are research studies about homeopathy, and one of the resources that you can look into is the NHS. So they have these are smaller studies that you can get out there. It's not comparable to randomized controls trials of medical institutions and facilities, but these are basically still studies that backs up homeopathy and how it works in terms of physiology. It actually has a neuro immunologic endocrine function. And with the energy that I guess behind the concepts of these therapies, it's really, yeah, I think Dr. Parvin got it right. It's really more quantum physics that actually will explain this a little better and deeper. But again, studies are out there, and this is something that I have seen and also studied at the same time while I was actually becoming a homeopath. So it's out there. Resources, I definitely can put in some in the chat in a bit, but it's just not easy to find for the reason that it's not conventional medicine, unfortunately, but it's there. There's science behind it, and again, it's definitely not placebo.
Yes. Yes, thank you so much. You explained it greatly. Homeopathy has to be explained by the science of water and science of quantum physics. Cannot be explained by science of biology, chemistry at all. And so, as you know, a lot of scientific data out there about science, that how powerful water is in terms of memory. The water has, from the beginning of life, the water has a strong memory, and that's how it's memorizing the original substance, and when you energize it, it's carrying those information. So a lot of scientific data out there, and science of water explains it so well. So in my articles, in my research, actually I explained the science of water first, then a science of quantum physics, in order to really truly understand how homeopathy works. And so it's not an easy thing, because even myself, I've been homeopath for over 2 decades. I've been practicing and treating thousands of patients, but I did not learn science of homeopathy at the school. They didn't teach us anything. And it's just, it was not my personal, interest in order to understand it, how my stroke patients recovered like that. It's exceeding my expectations. Even myself, with all this, knowledge of homeopathy, it was just exceeding. How does it work? So that brought me into this, going after the, understanding it deeper. So a lot to do, a lot to still work, but unfortunately, homeopathy has been attacked from left and right by the mainstream medicine, by pharmaceutical industries, and the research is in the hands of the mainstream. Homeopathy is not supported, is not funded, is not backed up. So we, as homeopaths, have to do something here. So because there's still is a question, and the first question was, the patient comes to doctor and say homeopathy is placebo, and Dr. Clearfield also said that a few times, that people say homeopathy doesn't work, and to me is just we all have to come together to bring it out scientifically. So that's my aim, my goal, to work on it, because it works. In my practice, I don't have to prove it to anybody that homeopathy works. But when they come to me with that question, I have to show them the scientific, document, scientific backup. So that's my goal, to go for it. Okay.
Okay, so Dr. Utami has a fairly long explanation about homeopathy and crystals. It's in the chat. I won't even begin to explain it. I don't know if he could try and explain it. If you could unmute and or not. And if not, you want to go on to the second case then? We still have.
Dr. Clearfield, would you prefer if I go to the second case and then we go through all the chats?
Yeah, sure. Okay.
Isn't it better?
Yeah, that would be better. Okay.
So the other case is advanced Crohn's disease. This one is interesting. Suffering from severe autoimmunity, and was 2014. The reason that I chose the older cases is just I want to, show to everyone that there is no recurrency after all this time. So, and that the thyroid tumor, or stroke patients, or this one, the Crohn's disease, to this day, they didn't have any recurrency. So July 2014, male, 75 years old. He was a family member of my thyroid cancer patient. So he was diagnosed with Crohn's disease. He had frequent diarrhea, severe intestinal bleeding, was losing so much weight. I think when he came to me, they said he lost almost 45 pounds. He was very pale and anemic. He was constantly having pain and cramps. He was on regular cortisone injection and oral cortisons. He was having several other allopathic medications, including antidepressants, because he was severely depressed. He was on 18 different medications for several conditions, such as high blood pressure, high cholesterol, high triglycerides, anti-inflammatory, anemia, constipation, sleeping, anxiety, for several years. When he came to my office, he had a bag. It was like he was traveling. It was a big bag. And he asked me to go through all this medication. I said, what are they? I said, these are the medication that he's taking. So actually, he came again with his wife. He couldn't walk properly. But, I went through the bag and I saw, I counted. There were 18 different medications. He was taking them on daily basis. It was shocking to go through his huge bag of allopathic medications. So I cannot see it here. Okay. He was hospitalized. He was hospitalized for a couple of weeks. Actually, the time that he came to me, he was hospitalized for a couple of weeks because he came right from hospital. But prior to that, he was hospitalized on and off, like maybe for 5-6 times he was hospitalized because he was bleeding. But this time he was hospitalized for 2 consecutive weeks before he came to me. He was undergone colonoscopy, ultrasound, X-ray, biopsy, and many blood tests. He was on a steady, strong painkiller and sedative medication for severe pain. His internal specialist urged him to remove a large part of his large intestine and place a bag outside, colostomy permanently. He was very terrified when he heard about this procedure. His family rejected the procedures of surgery to remove the large part of the intestine or using colostomy. His family decided to remove him from hospital immediately after they urged them to go for the procedure. And directly from hospital, they brought him to me on the very same day. So the very first protocol, let me just go back to, I gave him the emergency homeopathic protocol for his first protocol. I asked him to stop oral and injection cortisone upon his agreement. I cannot, it's not that I forced them to go off, but the only thing I can do is to ask them choose, because cortisone is confusing the vital force. and stopping the healing ability to be activated. It's like loading by cortisone and unloading by homeopathy is not going to work. So I explained that to them. If you want to be on a heavy injection, cortisone injection, and heavy cortisone medications, honestly, homeopathy is not going to work. So he willingly stopped taking cortisone. So emergency homeopathic remedies using an alternation for pain based on the similarity of his presenting symptoms. The very first thing I did, I gave them 2 homeopathic medicine. They were cholesynthesis, 30CH, and also bryonia. These are 2 emergency homeopathic medicine for pain, because he was in agony pain. He was holding his stomach, he was crying, and his wife was holding his shoulder. It was a terrible situation. So I gave him these 2 emergency medicine to use them back to back. So, and I asked them to continue taking them until the pain is subsided. The pain was still there, but became less violent and intense, as he explained it, after using these 2 emergency medicine. So the polychrist homeopathic medicine, the constitutional medicine, it was after the emergency medicine. As we know, I think all homeopaths know, Nux vomica is the main and prominent remedy for Crohn's disease. But I do not give it based on that. I always give it based on the totality of symptoms and the characteristic of the patients, which I knew him, and his wife, explained a lot about him, especially when he was going through this Crohn's disease and the reactions of the patients. So I chose Nux vomica 200CH because this patient was suffering from long-term chronic cellular intoxication due to a long-term consumption of synthetic pharmaceutical medications. The bag was shocking. The bag of 18 different medications was shocking. Practically, they were killing him. So Nux vomica was the best suited remedy based on his totality of presenting symptoms or disease presentations. He actually presented generally, characteristically, also Nux vomica. So I did not wait until the pain completely subsided. I just gave Nux vomica back to back with cholesynthesis and also with bryonia. Cholesynthesis, bryonia, and Nux vomica, I said use them back to back. In emergency cases, we have no choice sometimes because the pain is terrible and the patients cannot have a normal life until the constitutional remedy kicks in. So I asked them to use them back to back. So I add tissue salts, which is part of my treatments. I will never go without tissue salts because tissue salts are the structures of human body, and we need them for they have different roles in catalytic rules, electromagnetic rules, enzymatic rules, structural rules. So when the advanced pathology like this, they are severely deficient in these certain minerals. So I gave them tissue salts that they're indicated. They're indicated for Crohn's disease, such as ferrum-phos, caliphos, macphos, and Cali muriaticum. I gave them tissue salt for colic pain, in addition to cholesynthesis and bryonia. It's caliphos, ferrum-phos, calcareophos, ferrum-phos, caliphos, macphos, and natrum sulfuricum. And also a tissue salts for anemia because he was severely anemic, he was bleeding, he was so pale you could tell. And The tissue salts, including calcarea phosphorica, ferrum phos, caliphos, and natrum muriaticum. So I asked them to just take them, with 5 minutes, 10 minutes apart. And just maybe he went through 3 bottles in just 1 week, because my approach was emergency approach. So at this time, I started going on pathways remedies with homotoxicology. I focused on hepatic digestive system pathways for the second protocol. At this time, the pain was subsided. After the first protocol, he said that the pain was subsided. So he started this digestive hepatic pathways protocol. And also I gave him for intestinal regulations, for diarrhea, was still having diarrhea, for bleeding and indigestion. It was a complex including aluminum or alumina, bryonia, colocynthis, lachesis, lycopodium, mercurius, nox vomica, plumbum, and sulfur. This is an amazing complex for intestinal regulation, especially in Crohn's disease. So I added, as I always do, added gemmotherapy on the third protocol, added the gemmotherapy for guts, for digestion, liver pathways drainage, including ribes nigrum, ficus carica, Tilia tomentosa, Vitis vinifera, Juglans regia, Juniperus communis, and Rosmarinus officinalis. You can find in different supplier, you can find the mixture, the combined gemmotherapy medicine together, or you can give them just individually and ask the person to mix them together. So I gave them 2 times a day, morning and evening, and it was intense treatments. So as you know, gemmotherapy is not a herbal medicine, is not medicinal plants. These are different system of medicine, and they are prepared according to homeopathic principle dilution. I always add oligotherapy, trace elements, because 92% of chronic diseases is caused by mineral deficiency. This is proven. So oligotherapy, tissue salts, these are 2 different minerals in the 2 different preparations that I would always add it to my treatments. I will never miss it. So on the third protocol also, I add oligotherapy. I will never start detoxification and drainage before mineralization, because detoxification process, it needs a giant amount of minerals to have a safe detoxification. If there is no enough mineral during the detoxification and drainage, something will break down. So that's why I will never miss oligo elements and tissue salts when I do homotoxicology. So I added copper, the best trace minerals for intestinal inflammation and infections. I added manganese copper for chronic infectious diseases. Added zinc for impaired immunity. As we know, Crohn's disease is autoimmunity. It's an immune system support. I added selenium for autoimmune disorders, for inflammatory disorders. And also, selenium, and this is super antioxidant as well. So these are the best minerals for Crohn's disease. And also, never forget that from the beginning, I've always designed a nutritional plan for almost all my patients. But this time, for this person, it was very strict. So I told his wife that you got to treat your husband as a baby. He practically doesn't have intestine. He doesn't have digestive system. So treat him like a baby. Give him pureed food, only green vegetables. Stop animal food, because it's a heavy on digestion, and practically his digestion is so compromised. But the good news is that epithelial tissues of intestinal lining needs only 5 to 10 days to renew. During this 2 weeks period, I asked them to just treat him like a baby. So it should be easy on digestive system. I gave him plant-based diet, no animal food, pureed green vegetables, green vegetable soup, like baby food texture, no solid food for 6 consecutive weeks. So food restriction was very, was hard for them. And I eliminated almost lot of foods that he used to eat, such as nightshades, dairy products, wheat products, fried food, a lot of sweet sugar because he had sweet tooth. He was a heavy coffee drinker, and he was he loved only fried food, as his wife explained to me. So he was on black tea, coffee all the time, tobacco, alcohol, and fast. So I asked him no meat and no animal protein for 6 weeks because they are hard on digestion. So they accepted everything and they did everything perfectly. The strict diet plan was for 3 months. I asked him, don't have any raw food, because as I said, his digestion was so compromised and sick. So only cooked food in the way that I explained it to them, and very small portion. So I also pH balancing food diet. I educate them what kind of food they should have, not too much of acidic food, more alkaline foods such as green leafy vegetables, because they have high minerals. So the food that has high minerals, they're more alkaline. The food that are acidic, they have no minerals. So that's why he needed more alkaline food, such as green leafy vegetables. I asked him not to have wheat products, but switch over to brown, like organic brown rice bread, because he was a bread person. So he was having so much bread, he couldn't live without bread. But I asked them to go, and they had hard time to find in Canada, in Toronto, but somehow, somewhere they found it. And I asked them to toast it, double toast it as much as possible. Just go on dry crackers, no soda, no carbonated water, and all those things. No cold or hot drink, and only room temperature fluids. To just give the chance to the epithelial tissue of intestine to renew. So, but green tea, chamomile tea, fennel tea was allowed. And so what I always recommend to all my patients, go on your blood type diet or genetic diet, is the best way. So, and they accepted it. He was blood type O, and I gave them the book of blood type O, and they religiously went and followed his blood type. So his recovery was so quick. In less than 5 months, quick recovery only with one design protocol. As I mentioned before, intestinal renewal cycle is very, very fast. It's just about 5 to 10 days, or, in some cases, even, just 8 days. They were following my treatment correctly, and that's why he recovered very quickly. So I scheduled him bi-weekly for follow-up consultations. Was on, because his wife, one of the family was the thyroid tumor case that was completely recovered. So, and as I said, there were almost 45 people from the same family. They were my patients. So I kind of give them a little bit more attention, and I put them on a monitoring plan on a weekly basis with my treatments. And he had progressive improvement in the first 3 weeks, no pain, no diarrhea, no bleeding. he said digestion is much better, sleep is better, energy is better, and generally he feels better. So he went for the blood test and ultrasound, which I always ask them to go for their confidence. And the blood test done after 6 weeks from his initial protocol with my treatments. The report was lowered inflammatory factor, iron level higher, liver enzymes normal, RBC normal, white blood cells normal, less inflammatory cells detected. Result of ultrasound after 6 weeks from my initial protocol, they found still tiny scattered intestinal lesions, but no major lesion. So they brought the letter from their specialist, and it said tiny scattered intestinal lesion after 6 weeks of treatment. I asked him to continue initial protocol. Followed the same initial protocol without even one relapse for 3 consecutive months. He's done ultrasound again after 3 months, was normal. No lesions, not even tiny scattered, were detected. Complete recovery in less than 5 months. Crohn's disease never returned to this day. From 2014 to 2024, now he's 85 years old, no sign of Crohn's disease, and is constantly traveling. He's a happy 85 years old man. So, but after that, he continued going off allopathic medication drugs with me. So I had to treat him, gradually take him off all the medications. So he went off blood pressure medications, heart medications, cholesterol, triglyceride, skin dermatitis medication, and also on antidepressant, anti-anxiety medication, and gradually went off all the above medication under my supervision. Full recovery from all previous conditions. He reported never gone back on the above allopathic medication to today. No signs of Crohn's disease, free of all medications. Only one time to time, he's on homeopathic medicine for emergency cases such as cold and flu, having a healthy and active lifestyle, working. He's 85 years, but he's still working. He's traveling. And as I mentioned earlier, his entire family and friends of 45 people are my patients. So homeopathy is a gift from nature. These cases are the examples of hundreds of cured cases by my homeopathic treatments. Homeopathy is a genius system of medicine, a scientific and medical art. It follows the natural laws and healing principles. They're super healing and curative. Homeopathy follows inner healing principle and concept of cure and saves lives. When you treat the person correctly, the disease will be removed automatically. You don't have to fight with the disease. You don't have to go after the disease, just to treat the person that has the disease. So Bioquantum Academy has departments of homeopathy, classical homeopathy, and medical homeopathy, and integrative medicine. So, we have nutritional sciences, biocosmetology, medical ethics, and we are offering homeopathy research, advanced research homeopathy level 1, level 2, level 3 at the Bioquantum Academy. You can visit our official website, bioquantum.ca. A lot of information is there. And 2 major events are coming soon. One of them is a certification webinar on core principles of homeopathy on September 27, 2024. This is just, 2 weeks away. And also the 3rd international conference is a World of Homeopathy and Integrative Medicine, Past, Present, and Future Medicine. on November 8 and 9. If you want more information, you can always contact us or visit our website, bioquantum.ca, or email us at academy@bioquantum.ca. Thank you so much for your attention, everyone.
Thank you, Dr. Zarrin.
I hope I did not exhaust you.
Some of us would like a repeat though, so so we taking notes furiously. So
any questions?
yeah, anybody have any questions or comments? There was a comment about blood type O is able to eat red meat. That's the only blood type.
Blood type O.
Yeah. Yeah, well, you mentioned blood types, right?
What's the question, Dr. Clearfield?
Blood type O is the only blood type that's able to eat red meat according to that system.
No, blood type B also.
Okay.
Blood type B also can have red meat and blood type O.
Okay.
So blood type O can have any kind of red meat, such as beef and veal and lamb. But blood type B is doing well with lamb.
Mm-hmm. Okay.
So
great.
That's a bonus.
Okay. And there is a link here for a study on menopausal homeopathy remedies. I pulled it up. It's in the chat. It's timed at 6:12 p.m. if you want to find that. And then there's a couple of slideshows about quantum, I believe, quantum biophysics or vibrational biophysics as an explanation for homeopathy's mechanism of action. So there are a few explanations there from some others here. And just as far as the webinar on September 27th, it was in this week's link. We had it advertised, and there was a link if you were interested in it in last week's email, and I'll have it again next week and I guess the week after. So we'll have the link if you're interested in that. As far as the courses are concerned, they're quite extensive. To get through homeopathy 1, 2, and 3, how long should that take, Dr. Zarrin? Just as an example.
To get through what? Sorry.
Your homeopathy courses 1, 2, and 3.
Homeopathy work? You mean diploma program?
Yeah, the diploma programs.
Oh, diploma program. So level 1, level 2, level 3. So level 3 is for the ones that they have homeopathic background. They already have homeopathic background. So it depends. In normal, they can finish it in 12 months or 12 to 24 months. So there is no restriction.
Mm-hmm.
The only thing they cannot finish the diploma program less than a year. But after that, they can extend it to 3 years. There is no restrictions. But if somebody can finish it earlier, they can finish it. So, but the course, that's a program. But the course is normally 10 hours. All the courses at the Bioquantum Academy are 10 hours, including the Q&A, including the discussion.
Mm-hmm.
So, but in webinar that we're having on certification webinar and having on September 27, actually is a compact kind of, the 10 hours becomes 4 hours. So we're going to cover almost everything in one full complete course in just 4 hours. So that's why the certification, it's equal to one course, one full course of 10 hours.
There you go. I mean, is there a cost to join? Is there
the cost
for the webinar?
I think it's $150 something. I don't know. It's just it's on the website, I guess. But I think they decided, because the webinar and the conference of there are people working on it, right? So, and I think they decided to have a group rate. If there are 3 people, you know, that they have some discount. If there are 5, if there are 10, so there is group rate as well. So,
so there's a group rate for our group, right?
yes.
Okay, so you tell them you're coming from our group, right?
Okay. Anybody says doctor coming from Dr. Clearfield, they get 50% off.
There you go. How was that? That was pretty good. Now I'm going to work on her for another 50% off. We'll do the best we can.
They get 50% off already. So
Okay.
no, I
Yeah.
mean, you know, Dr. Clearfield, what the reason I designed I like to offer this kind of webinars because we're receiving a lot of inquiries for homeopathic diploma, a lot. But when I interview them, they're not good candidates. I mean, not good candidates. I mean, they need to have a little bit of knowledge prior to coming to diploma program. The reason is here, we don't want to do business with anybody. We want to educate people. And we don't want to throw them in the ocean without knowing how to swim. So it's a preparation. I like to be like, for example, we have a collaborator in Middle East. They just joined the Bioquantum Academy. They're a huge community in the Middle East, from Emirates, Iran, Turkey.
Mm-hmm.
They're joining us for to be part of diploma program. But before I told them, before signing up any students for homeopathic diploma, please bring everybody to the webinar. Let them assess themselves as well. After getting the knowledge, but it's not a basic knowledge. It's almost complete knowledge that they should know prior to coming to the diploma program.
Mm-hmm.
And then we can assess them, they can evaluate themselves. That's a reason for the webinar. So I think it's a great way of evaluating yourself before jumping into the diploma program. Because diploma is a serious program. You have to go, you have to study all the courses, you have to go through research, and you don't want to waste your time if it's not for you. But if you come to the webinars for just investing 4 hours and a little bit of contribution, then you will assess yourself. Are you a good candidate for this? The reason is because 20-some years ago, when I went to homeopathic school, I came from allopathic background too. And it was like we all were crying at the school, at the class. We didn't understand what the professor is saying. From contrary concept, you're coming to similar concept. It's completely extreme opposite of each other. And you are here to understand. And nobody told us. We couldn't ask questions. They say, if we ask questions, say, why did you come? And as I said, it was like throwing us in an ocean without knowing how to swim. And I don't want that for people. So I don't want anybody experience the challenges that I experienced. So I want to make educational life easier for people, especially homeopathy, because it's a hard thing to do. But it's the most rewarding anybody can do in their lifetime. So, but it's a preparation. Webinar is a preparation.
Mm-hmm.
And
okay. Two things. One, what time is the webinar?
The webinar starts at 10 a.m. Eastern time.
Eastern time. So
until 2-3 p.m. So
okay.
We say 4 hours, but I'm always going to be, I open the floor.
You frequently go longer. Yes, I know that.
I open the floor always, earlier, and I always stay way much longer. So if they have any questions.
Yeah. Okay. And speaking of questions, Dr. Nario has some questions from online folks. So
Yes.
go ahead. You're up.
Dr. Parvin, great presentation. Some questions for you. The presentation kind of noted that there are conditions that for sure will be involving prescription medicines, like for your stroke patients and also your Crohn's disease patient of using steroids. In your approach, what are your thoughts in relation to combining homeopathy and prescription medicines?
Okay. As I mentioned on Crohn, for example, Crohn's case, right? On cortisone or steroid, homeopathy is not going to work. It's not going to work. It's just, and I'm not here to do business with patients. So I told them clearly that if you still want to be on injection, homeopathy is going to get exhausted. It might work, but again, it gets exhausted. And we don't want people having a wrong, kind of perception about homeopathy. But again, if I have a couple of Crohn's disease, actually in the United States at this present moment, they did not want to go off their injection, the diffusion. So I am working with them through the patients, working with the doctors, so to reduce the dosage of the diffusion of the I don't know, it's in a form of injection or whatever, and also extend the duration. Instead of 1 week, make it 6 weeks. 4 weeks, makes it 6 weeks, and also reduce the dosage of the medication. And their doctors actually doing it. And I'm so happy about that. If my patient reported that their doctors agreed, I never met their doctors, but I am communicating with them through the patients. What I asked them, they said that they reported it to the doctor and they agreed. So now the follow-up is coming actually next 2 weeks, and we'll see the result. But the improvement is amazing. Their improvement is amazing. So, but again, the oral medications, they went off on their willingly, they went off. But the injection, they couldn't go off, and I cannot force anybody to do that. But I said, if you don't ask your doctors to extend the duration of the 2 injection and also reduce the dosage, homeopathy is going to stop working.
Right. Yeah. So that's a good thought. In my experience, one of the more common questions that I get from patients would be, if they're on a medication and they're started on homeopathy, would it affect their current prescription medicines? So what I answer them about this is definitely not. Homeopathy definitely will definitely not alter the specific medicines that they're on. So a good example would be that stroke patient. We usually in conventional medicine, these patients are going to be on statins, on blood pressure medicines. And one concern that they will have for us would be, of course, would they need dose adjustments on these specific medications that they're on? So one thing that I've seen, and I always do, for example, detox remedies on these patients, and I add these homeopathic remedies freely, and no interactions noted after years that I've done it. So that's definitely something that I guess clinicians who are not experienced in this field should probably know. I mean, we're talking about we're not talking high doses of homeopathic remedies here. Of course, as you said, low doses would be addressing more of the physical aspects of these patients. That's why it's something worth knowing, especially for the ones who are combining, who are not pure homeopaths, but also allopathic in a way, and also homeopathic on the side. So just some thoughts there. Another one would be on your I think your first international conference, there were some doctors from India who were using constitutional remedies using computer programs, and they punch it in and they'll find a specific remedy in relation to that. Is that something that you're doing as well?
No. I'm very Hahnemannian, so I have 2 radars, but I never use them because materia medica is close to my heart, and I know all the polychrist medicines, and I stick with polychrist, and I don't use radar. I used it when I was a student, but not necessarily, I need it. As I say, I love materia medica to just go and, read the medicine. So I'm a very conventional, kind of conservative homeopath. That's how some, mostly in India they do it. I don't know why, but Canada, it did not, doesn't have a place. So, but again, if you want an easy way to find the medicine, but again, radar, one danger of radar is if you enter wrong rubrics, it's going to give you wrong medicine. So if you have the right rubrics on your own, so you can easily find it in materia medica, you don't need radar. But radar, draw two wrong rubrics entering to radar, that gives you the first 3 wrong medicine. So
yeah, and these programs are not cheap when you subscribe to them or buy them. I think one of the clinicians in here is Dr. Burgess. He probably has I spoke to him one time, and he uses these programs, and nothing beats going old school, right? Especially if you're pretty familiar with materia medica. Definitely you can just do it manually. Some of the newbies usually go for the program ones, and again, I can't blame them. It's definitely tough. You need experience to use constitutional remedies. And this question, I think, was pertaining to arnica, but understanding that I think they saw this in your chronic stroke patient, and most of the time, arnica is known for, of course, acute conditions, and you used it in the situation as your first remedy because of bruising in the brain and bleeding in the brain. And I think the question there was, why was it used? And most of the time, if you're going to be using a constitutional remedy, it's usually that's going to be now more of the chronic approach. But for the acute approaches, it's usually more for, yes, the immediate problems that you see, like immediate bleeding. But yes, on your side, I think that was the question. Why was arnica used on a chronic stroke patient? I think the question was coming from the fact that arnica is usually famously used in acute conditions. But I think I know the answer, but let's take it from you.
Arnica is an emergency remedy for sure, but the stroke patients after 3 years still is what in an emergency situation. He was not cured, he was not healed, he was still in an emergency situation, and actually worse. So, and arnica was the indicated remedy for him. So when the body did not heal, still the body is in emergency. So arnica applies in all cases that they're not already healed. So yeah, arnica is the first one to call for stem cells, because the stroke patients, they need millions of stem cells for repair. So the only one that can do it is arnica. But I got
Right.
help from the other remedies such as homomelis because of the the bleeding during the stroke, and all the medicine that they were indicated. I used them, but the very first one is Arnica. So the same thing with the like infertility. I don't know if you last time, Dr. Nario, you were here, so I went through the case of infertility. 11 years of trying, and still to me she was in an emergency situation. I gave her Ignatia Amara. Ignatia Amara is an acute grief remedy, but then I switched her over to the chronic grief natrum muriaticum. The same thing with the stroke patient. I gave them arnica, then I moved them to causticum. So again, when the body is not healed and the body is in either the same situation or worse, is calling for emergency medicine. And the comment about, Dr. Norio, the comment about your previous, you mentioned about the coexisting of homeopathic medicine and prescription drugs, prescription allopathic, and there is no interaction. So in terms of getting into the body, there is no interaction whatsoever, because homeopathic medicine does not go to digestion and has nothing to do with the chemistry. But prescription drugs, it's going to go to digestion, needs to be absorbed, and goes to the bloodstream and blah, blah. But when it's coming to the time of assimilation and healing, the interaction started there. The problem starts there. That confusing the vital force. It's like homeopathy is unloading and prescription drug loading again, right? So homeopathy is trying to activate, prescription drug try to suppress in order to manage it. You cannot manage symptoms without suppressing the disharmony. You have to suppress the disharmony in order to manage it. But homeopathy, on the other hand, is trying to activate the healing power. It's the opposite of suppression. So the problem starts here. And plus, we're trying to, open up the blockages with the homotoxicology or pathways to cleanse the body. Again, prescription drug is intoxicating the body. So the problem starts here. But the best way so far that I have to, to manage is to reduce the dosage of prescription drugs during homeopathic treatments. Try to reduce it. That's my comment on your previous question.
All right. Well, that's all on my end. Thank you.
Yes, I know you are in a hard position, Dr. Nario, and also Dr. Clearfield. Medical doctors are in hard positions for sure. And on one hand, you cannot get them off, prescription drugs because for any reasons. On the other hand, you want to help them to activate their healing power on their own, and definitely is not an easy thing. But this is with only one formula: either they go off, or you try to taper them off.
Okay.
Then homeopathy works the best.
Okay. All right. Any last word, Dr. Zarrin?
Last word. I'm just trying to see if I know anybody in today's seminar. Okay, Dr. Otami is here. Oh, Heather is here. Let me see. Dr. Otami, hello.
Hello, doctor.
I didn't know you were here. Awesome to
I'm
see
in the
you.
beginning. Yes, thank you.
Oh my goodness.
I also bring my friend from Indonesia, Dr. Sri. There's a lot of doctor Indonesia here. We are still learning about homeopathy and hope in our country have a registration
Oh,
immediately. So
amazing. Great to see you,
mm,
Dr. Clearfield.
Yeah.
Dr. Otomi is our collaborator
Oh,
from Indonesia. We are having 12 medical doctors graduating from her institution.
wow.
So
Quite impressive.
yes, amazing, amazing, great. Thank you so much for joining, Dr. Otomi.
Yeah,
So,
thank you, Doctor.
so she was the one I
Thank you,
was
Dr.
Dr.
promoting.
Clearfield and Dr.
Thank
Melvin
you. And
Nario also.
just to let you know,
Those are so
we're
great.
here every Tuesday night, and hopefully you can join us again and maybe even present for us. I'm always looking for somebody. All of our previous programs are at aosrd.org/webinars or on YouTube at Clearfield Medical Group. You'll find all our videos, and we're starting to catalog them and it gets because we have 4 years of like really great information, and we're trying to extract that and put it into some sort of a system that we can use. So please join us, Dr. Itami, anytime. And if we can get your contact information, maybe we can even have you on for some presentations, because we're attracting quite an international crowd here. So we have every week we've been having a big crowd for folks from the Philippines, our friend from Austria. Her son's with getting specialized treatment in Poland this week, so she won't be on, but hopefully she'll be talking to us. And a relative of my lady friend came to visit last week, and she's a PhD cell biology student in Paris. And she's not on tonight, but she's going to be on with us also. So we're attracting quite a large audience, and uh, and if anybody, send me an email to my email address if you're not on, and I'll try to get everything out if you can get it there. I think I sent the whatchamacallit programs, the where to get our things just to one person. So here they are. Okay, so here's aosrd.org/webinars for all our previous programs. Also on YouTube, Clearfield Medical Group. We have about 4 years worth of programming on there, like I said. And if anybody's interested, please, when presenting, please let me know. Like I say every week, bring one friend. We will double our census if everybody can bring one friend. Next week, we have Dr. Jeff Block on. He's one of our cannabis experts. He's going to give us an update. He's in Florida, and there's some big doings down there with cannabis. I may or may not be here. It's my grandbaby's, two of the oldest ones' birthdays next week. I'll be outside of Detroit. I'll probably be on. If not, I'm sure I can get Joel and Dr. Nario to host it here. So we will be here, but I I'll probably be on, but I may or may not be on. So remember one time I was there and I ended up having to host it off my telephone. I think it cut off halfway through. So we try not to do that. Anyway, everybody who's here, please, thank you so much. And the folks from Indonesia, really welcome. Please come back. And of course, our Filipino friends, we want you to join us, always also. So, and Dr. Nario, maybe it's too late tonight. Give us a little summary of the conference that you had in the Philippines, where you were the keynote speaker. So, or should we save that for
Yeah. Yeah, we can do it next time. But yeah, just to tell everybody that I had a great time. The Filipinos were really hospitable, and all 3 days I was speaking, and I actually lost almost my voice at the end of the conference. And to cap it off, I got guested in a TV program, and they interviewed me about integrative medicine. So that kind of spreads the word out there for everyone, for us to be heard and be known. That's why I enjoyed my time over there, and thank you very much. I could elaborate a little bit more next week.
Were you for it or against it, by the way?
Oh, I'm in the middle. No, I'm kind of sorta. I don't know about integrative
Sort, kind
medicine.
of, sort of, right?
No, we fight for it. We stand for it for sure.
Dr. Zarrin must be tired. She didn't even
No.
smile at that. So,
I
okay.
just want to say hello to Dr. Farbot. Dr. Farbot, thank you so much for joining us tonight.
Hello to everyone.
Hello, hello.
Thank you for this workshop. I enjoyed it every moment. Thank you so much.
Yes,
You're
thank you.
welcome.
Thank you
Dr.
for-
Farbot actually is going to join our webinar and already registered, and also she is going to join our diploma program hopefully soon. And thank you so much for joining us.
Thank
So,
you. Thank you.
Thank you.
Bioquantum Academy is getting
Then what?
very busy.
One last thing, Dr. Quinn, you had your appointment book on screen upside down, but we couldn't read. We could see writing there, but we couldn't read what the appointments were. Was there anything important that we should know about? Because it was on screen for quite a while.
Yes, I have an appointment with the president coming up.
Well, it's not.
No, there's nothing important in
As
there.
important as being here, you know. It's
No, nothing as important as being here.
right. And John, are you still on? Is John still on? No, I guess he's gone. Okay. So we'll get an update on what he's up to. I know you want to have anything that you want to talk about? You had Saturday, you had a phone meeting about your research group.
Yeah, it was kind of like a kickoff thing. We're first of all very excited about everything because of the like-minded people here, and we're looking at ways and different things to research out and using whatever I guess you'd say means of funds or whatever that we can, kind of like my thought is it's mostly like a homegrown type of thing that we'll do research into areas that we know can benefit people. Everybody here is pretty adept at their treating of patients with various things. And if we can kind of get it going as a research type of format or platform, we're probably going to be able to have more bang for our buck, as it were. It's still just in the nascent stages. We got everybody together. The one guy that was on here is Dr. Ben Zavenia. He's an ND, but he's also a judge, and he's crazy. That's why I like him. But he and I guess John were at a conference years ago in Sri Lanka, in the same room, learning the same things, and they just found that out. So there's a great synergy with the great minds there and what they have for us. But again, it was just in the beginning, and I think John invited a whole bunch of people to participate. So we'll just keep it going and keep everybody posted, and everybody's invited to participate if they'd like to. I mean, people like Dr. Zarrin and all that, with all of the good stuff that's being done. Gosh, it would be really nice if we could do something that grabs the attention, shall we say, of those that are stuck in that model that think that the only thing works is a double-blind study or placebo-controlled, something like that. When my thought is, if we put together some type of studies like this, that maybe we'll garner a different type of attention, and there won't be people that will ask questions like, isn't homeopathy, is that voodoo, or is that a placebo? If we had studies that fit more of their model, they might pay more attention, and the bottom line is patients will get better, and they won't be told by people that they hold in high esteem. Let's say the allopathic model, those guys that poo-poo everything else, that they think that what they're doing is the end all, and if they don't know it, it doesn't exist. And that's kind of what I think we're I don't want to say fighting, but we're trying to win them over. Let's put it that way.
Okay. By the way, the answer is homeopathy a placebo? The answer you should tell them is, of course it is. Of course it is.
You wouldn't be interested,
right? That's what they want to hear, right? So
yeah, exactly. And I sent you guys that little
don't
slide
get upset, Dr. Zarrin.
yeah, she's gonna start.
I know.
I sent you that little slide because I too have run into this.
Yes. Yeah.
You know, when we compounded things, we put in homeopathic products into standard IVs, you know, kind of running under the radar of everybody else, the FDA and all that. We had wonderful success with that, but all of the physicians would say, well, what is that? Why are you doing that? What is homeopathy? Why put that in products? And, you know, I had to come up with a whole PowerPoint presentation on why. It was rudimentary, but at least, you know, I was trying to make it simple for them to understand.
Yeah. That's why we are scheduling webinars, you know, like 12 webinars throughout the year to explain homeopathy scientifically to doctors.
Yeah.
They are lost. They are in one end, homeopathy works. You know, my practice is the what you call it, the example of it. But on the other hand, they don't have much of scientific backup, right? Scientific backup. That's why you know, we started doing this, and these kind of webinars is going to help, especially doctors. They have questions, so you understand what. And after that, they say, well, "What did you say, placebo?" They're gonna blame themselves for their questions.
Yeah, that's crazy. If you have a minute, I can share my first experience with homeopathy. It's a very embarrassing story, but if you got 2 minutes, it might be worth it. At the University of Southern California, we were not taught anything about this. We were taught allopathic medicine, and if there's a condition, there's a drug. Okay, and so I thought it was a little bit odd. Well, the embarrassing part here, and it's just a quick 1-minute story, is I don't know if you know what a thrombosed hemorrhoid is, but it's like a watermelon has been shoved up there, and it hurts like crazy. So I went to a proctologist who I referred to as the Rear Admiral, and they have this treatment for you where you get on a table, you bend over, they stick a huge needle directly into this thrombosed part and fill with lidocaine to numb you. Then they slice it, then they stitch you up, and then they send you on your way. Okay, this is ungodly painful. All right, it happened one time, and I thought, oh, okay, wait a minute, should I stop lifting weights? What happened? Why am I getting this? And they said, no, just do what you want to do. Almost a year later, the same thing happened. And this guy said to me, well, having this done once a year is not so bad. I said, you ought to be on my end, right? This hurts. This is ungodly painful. My best friend, who was a pharmacist and a chiropractor and practiced homeopathy, it happened again. And he gave me something I will never forget. These little things called hemorrhoid 48, right? And I started taking those things. And of course, it happened on a Friday, so I couldn't get in to see the Rear Admiral till the next week. And I started taking those things. And on Monday morning, I canceled my appointment. And I called him up and I go, what in the hell is this stuff? This homeopathy is something we didn't learn about. And I'll be damned if this isn't better than what we learned. So that was my first experience right there. From that day on, boy, I was a believer.
Mm-hmm.
Thank you.
Sorry to share such
great experience.
Graphic story. You know, it's not like a cold sore going away, right? I mean, this is critical.
It is. It is.
Okay.
It's fascinating.
Right.
Yeah.
And
so with that,
that's a good way to send everybody off for the week.
So the often question, it's the question that I am often asked is, what was your goal? I said that when I convert as many allopaths as possible in my lifetime.
Yeah,
So
pretty much,
Dr. Cohen, you're one of them.
Yeah.
pretty
Oh, yes.
pretty much everybody here is a recovering allopath, right? Recovering.
You got to recover first. You have to go to recovery of allopathy.
Yeah.
You see, don't get me wrong. Allopathy has its own, existence.
Yeah, we want to keep it over there.
10%.
It has its place, and we want it to stay there. So, right.
It's a trauma care, emergencies situation,
Sure.
and a handful of infectious diseases or something like 10% of cases, but they have no solution for chronic diseases, which the whole world is suffering from. The whole world is suffering from chronic diseases. How many acute conditions did you get it in your lifetime? How many accidents do you get?
Yeah, well, hopefully not many.
Yeah, how many traumas? No, it's not. But chronic diseases is just this epidemic. It's just, and unfortunately, they have no solution, but to just intoxicating the bodies, and we are here to fix it.
Okay.
The only way that we can fix it is just to convert allopaths to homeopaths.
Yeah, and
So which we are doing it. So they told me that it's difficult. It's hard. As I said, we will do it. And now Dr. Otami is in the conference now. 12 medical doctors from her institution that studied at Bioquantum Academy are graduating. They're all medical doctors.
well, okay. Well,
And you have another 4 medical doctors who graduating.
now we know where to go when the AOA runs us out of the country. So, right?
So no, I mean, in just short period of time, we did it, right? Imagine the next 10 years, the next 20 years. So we're bringing all allopaths with us.
You're doing great, Dr.
Zarrin also. Dr. Naria also is already with us.
Dr. Zarrin, you're doing great.
Thank you. You too. And I want to thank Dr. Clearfield again for he's been doing an awesome job. I think it's you have been doing it for 45 years. Imagine not giving up.
Maybe I'll get it down right one of these days, right?
Why don't you immerse it with the Bioquantum Academy? Make it easier for yourself.
Well, that would be way out of character for me. So
no, with the webinars,
I have to do everything the hard way. So okay,
with the webinars,
we're gonna say good night. I think everybody have a great. It's almost 10:30 on the East Coast, so we'll see you again next week, same time, same station. Again, we'll have Dr. Block. We're going to get an update on cannabis and all of and everything that's involved with that. Good night, everybody. And I'll try and get everybody's email so that the new folks get let you know what we're up to. Okay, so again, Dr. Zarrin, thank you so much. I can't thank you enough, and of course we're going to be calling again.
Yes.
Somebody wrote in here that they tried to get on the website to register for the webinar, and they couldn't find it. So we had it in our email this week, and just check on it. Okay, I'm just letting
the webinar is just on the right beside international conferences up there.
It was in the email announcing this, and I'll have it in for the next 2 weeks until the webinar. Okay.
Thank you, everyone.
Thank you, and good night.
Thank you, Dr. Clearfield.